The honourable member for Courtenay-Alberni.
Madam Speaker, at the conclusion of this stage of debate on Bill C-216, I first want to thank the members who've spoken today. Canadians deserve a debate on how to respond to a public health emergency that's been raging for more than 6 years and cost more than 27,000 lives. Bill C-216 is the first piece of comprehensive legislation aimed at addressing this crisis to be debated in this House. But with respect to my colleagues here today, I believe who we really need to hear from are the experts in public health and substance use, the people working on the front lines of this crisis, and those with lived and living experience who've been directly affected. Those are the people I've been speaking to since I became the NDP's critic for mental health and harm reduction. Over the last few months, I've traveled the country to hear how the toxic drug crisis is affecting communities across Canada. What I've heard is people are frustrated the government is not doing their job to help Canadians who are struggling. Their angry politicians don't seem to care about the lives of their loved ones. When COVID-19 hit, the government acted with a sense of urgency and was willing to take bold steps to protect Canadians. It worked rapidly to roll out income supports, to procure enough vaccines for every Canadian, and to procure enough vaccines for every Canadian, like I said, Madam Speaker. And the government's response to COVID-19, it hasn't been perfect, but it showed a willingness to act and adjust as needed, because inaction poses a greater risk. Yet after 27,000 deaths in the overdose epidemic, this government is still talking about pilot programs. It has done consultations and commissioned reports that have seemingly gone unheard. I hope all members will agree that it's time not only to listen, but it's time to act like lives depend on it, because they do. Last spring, Health Canada commissioned an expert task force to make recommendations on federal drug policy. The task force was comprised of people with expertise in mental health and addictions, public health, law enforcement, criminology, harm reduction. The task force also benefited from the lived experience of members of Black and Indigenous communities, people who use drugs, and those who have lost loved ones due to drug-related deaths. The task force published 2 reports that convey a very clear message. Canada's drug policies are not working, and they need to change. They're causing irreparable harm to our communities, Madam Speaker. They're costing huge sums of money, and they're costing lives. The proposals in Bill C-216 reflect the recommendations contained in the expert task force reports. This bill would work to stop harms of ineffective drug policies and set Canada on the path to dealing with substance use in a comprehensive and compassionate way. Before members vote on this bill on June 1st, I urge them all to read these reports, at the very least, their recommendations. My other request today to all members is that even if you don't agree with the full contents of Bill C-216, please vote in favour of sending it to committee. Hear from experts and those dealing with impacts of this crisis and bring amendments to the table. Senator Gwen Boniface, the former commissioner of the Ontario Provincial Police, and Senator Vern White, former chief of police for Durham Region and the City of Ottawa, both supporting getting this bill to committee. If you're considering voting Bill C-216 down at this stage, I ask, what will you tell your constituents in 6 months' time, in 12 months, in 3 years? This crisis is continuing to escalate, and every day more Canadians are losing someone they love. How will you explain to them that you did not think it was even worth discussing solutions? This morning, a staff member of mine shared the words she spoke at her brother's funeral after he died of an accidental overdose poisoning a week before his 35th birthday. She commented that every day there are Canadians writing speeches for funerals that shouldn't be happening. And the words she shared was a quote from her brother's favorite poet, Oscar Wilde, who wrote, quote, "The only difference between the saint and the sinner is that every saint has a past and every sinner has a future." She went on to write, "I wish Ryan had another chance to build the future he wanted. We're all flawed, and I hope through his memory we can remind the world that every life is beautiful and has value. Everyone deserves compassion and love, and even in their darkest times." With this bill, we have a chance to send that message that we care about people who are struggling, and we will be there for them. We have a chance to save lives. I urge this House to rise to that occasion, to this occasion. Thank you.